My name is Diana Parret, and I live in Fresno, California. I got some symptoms that kind of was surprising. And being in a menopause situation, you think, oh, okay, just a short little blip. And it continued. But then through work, I couldn't do anything because I was losing my job and I was going to be losing my insurance. And you wake up every day knowing that there's something wrong, and so what am I going to do? And it was difficulty through information and navigating the computer, and I'm not good with computers. In February, I was at Kaiser to go down to the business office to see what could be done to get back to Kaiser. And as I went to the business office, there was this beautiful kiosk, and there was a gentleman. He went through the computer thing that was on the kiosk and basically ran through the program and what options I had. So he said to go down to the KP store. He made an appointment for the next day. The meeting was great, the shop was fabulous, everybody was friendly, and sat down and told him my story and told him what I needed. Within an hour and a half, I was signed up. And that was really, really a peaceful feeling, because knowing that I have insurance now and I'm back with Kaiser, because I had been with Kaiser prior. I saw Dr. Reeves on TV. I looked at her and she said she was OBGYN at Kaiser, and I went, oh, if I go back to Kaiser, she's the one I'm going to go to.
We had been working as a department to, kind of open up and be available for patients who were new to Kaiser, who hadn't been here, and trying to make sure that we were able to accommodate new patients and get them in as soon as possible. In the appointment, she told me her symptoms, and I told her my concerns, that I was worried that abnormal cells can be happening in the uterus, that we need to investigate, and she did get that biopsy, but we made arrangements so she was comfortable, and she got the biopsy done. I was able to tell her, look, you have cancer, I need you to be seen.
She said, I need to make sure you get this taken care of because this is a very aggressive, fast-growing, nasty cancer. So she stayed on the phone with me on her day off and made sure that I got set up with a facility outside of Fresno.
We don't have gyn-onc or gynecologic oncology in Fresno, and so for Diana, her family is in the Walnut Creek area, and we have gyn-onc in Walnut Creek. On my computer, laptop, and on the phone with her is pull up the eConsult system and find Walnut Creek and look at the physicians. I pulled up their home pages, and I was able to read to her a little bit about who had what background, and we selected an appointment for her. It's a really coordinated effort and trying to make it as seamless as possible so that she didn't feel lost.
We've really switched over completely to doing almost all of these cases for uterine cancer in what we call a minimally invasive approach. So either what we call regular laparoscopic surgery, or with the use of this new tool which is called the Da Vinci robot. She, came into surgery with an amazing positive attitude. She was having everybody in laughing in the operating room with her while she was falling asleep, and did great post-surgery, which really has a lot to do with her attitude and her desire to just be well.
The surgery went well, the healing went well, and then of course you wait for the pathology, because you don't know where it's gone. So then on the 7th of April, she called me that they had caught it in time, no chemo or radiation. That was the beginning of my life again.
So now we're just following her over time, which she's getting that care here. She's back with us, and we have medical oncology who can then follow her.
The feeling is so overwhelming to know that it went so quickly. I mean, it was like somebody was just moving me in. Just like, okay, this is it, this is going, and it worked. If it had gone longer, I don't know what the outcome would be. I'm really working on diet and food and trying to heal my body and not putting in things that it shouldn't. I'm thankful that I was able to have this type so I can take care of my mom. She is fully deaf, and she's very dependent on me. And so for me to have a problem would have been an issue for her. These people helped me take care of my problem. Because, you know, there are good doctors, but there are great doctors. And I was fortunate to get great doctors.